We are clearly looking at if insurance comes into play, we are clearly looking at something like a 15% reduction in the claims amount overall through home care. If you're able to create a care plan and there is a continuum of care from there, the home care kind of fits in, saying that after say surgery, x number of hours, x number of days, most of the surgeries can be actually a day surgery, right? So after that, who takes care of that patient? So, and you create a care structure which is already set. So I think that is the time when it is best. Well, recently I had a personal experience that my brother-in-law's supposed to get a surgery for 20 minutes, and he had to stay 9 days in the hospital. The bills were big. I mean, he was finally so depressed that he said, like, he wants to run away. And big hospital, I cannot name them, big hospital. So I think the problem with such a structure is that when we cannot push it, right? I mean, insurance is the payer here, so insurance has to kind of push it from that perspective. What we can bring is that saying that after surgery, the to make sure that these are, say, the protocols that needs to be maintained. These are the care plan that needs to be ensured. There's a reporting that kind of goes back. These are the kind of professional people and instruments, medical instruments, blah blah blah. Everything that is required is something that we can do. I think clearly we are looking at some 30 to 40% loss reduction if we are able to integrate home care into the post-surgery segment. Into other segments also, if you are looking at, say, post-acute events, also, I mean, there is a huge benefit that we'll get. And that is the time when I think when the hospital would also start focusing and on the acute care much rather than taking people and retaining them into hospital for no reason. I think that will kind of reduce. But we are clearly looking at if insurance comes into play, we are clearly looking at something like a 15% reduction in the claims amount overall through home care.